We turn now to the coronavirus pandemic. The Delta variant has spread to all corners of the United States. This has prompted officials in Los Angeles County to reverse course on indoor masking, following a recommendation from the World Health Organization. And experts say unvaccinated people are the most vulnerable to this strain. So far, more than 46% of people in the U.S. are fully protected, and just over 54%, or at least halfway there. Jamie Yuccas reports from Los Angeles.
Tonight, the Delta variant is spreading so fast that LA County now wants everyone, even those fully vaccinated, to keep wearing masks indoors.
I feel like there's going to be more than a couple of people around. I wear one.
68% of LA County residents 16 and older are now at least partially vaccinated. Of the more than 400,000 cases reported in the county since December, nearly every single one occurred among the unvaccinated. The same with COVID-related deaths. And there's new concern as the Delta variant, first detected in India, now makes up 95% of all new cases in the UK and is forcing new lockdowns in Asia and Australia. Here at home, it's now in all 50 states.
It could be that it's better at actually attaching to a human cell and entering it. So you have a lot more virus and so more shedding of virus.
Now, word of an outbreak at an Illinois summer camp. 85 teens and young adults tested positive, one hospitalized. The state reports that all campers were eligible for the vaccine, but only a handful actually got it. Tonight, a promising study from Moderna suggesting its vaccine produces an antibody response against many known COVID strains, including the Delta variant. While questions remain about J&J, it's still unknown how effective that vaccine is against variants and whether a booster shot might be needed. The worry, how to stop the spread.
I am concerned that over time, the more chance you have this virus to mutate, the more chance it has of mutating into a form that can wreak more havoc. You worry that over time, the immunity that we've developed, either because of previous infection with COVID or because of vaccination, is going to wane as the virus continues to evolve.
California reopened just 2 weeks ago, dropping mask mandates for those who are fully vaccinated. Now, after having to wear a mask for more than a year, it may be a tough sell to get people to put them back on. Nancy?
Jamie Yuccas, thank you. Dr. Ebony Jade Hilton joins me now. She is the co-founder and medical director of Goodstock Consulting, and she's also an associate professor of anesthesiology and critical care medicine at the University of Virginia. Thank you very much for joining us, Doctor. Now, concerns over the Delta variant are mounting not only in the United States, but really around the world. Remind us what we know about this strain, especially as more people we see relaxing their coronavirus safety measures out there.
Yeah, what we know about this strain is that it is the more serious strain that we have to deal with so far. It is not only more contagious, but it also has an ability to evade our immune system, right? So we're seeing where persons that are fully vaccinated are still contracting the infection and unfortunately are having serious disease. And unfortunately, some of which have actually died. And so when we're thinking about this idea of these mutant variants, what we have to know is that we cannot afford to let our guard down. That I do agree with the World Health Organization that says we need to start masking up. In Los Angeles, we need to start wearing masks. But it's not only in those areas. When we're looking at the vaccination rate in Mississippi and Alabama barely reaching 30%, those persons need to be hypervigilant because the Delta variant can cost them their lives.
And as we look internationally, some nations that we saw have already reinstated those lockdowns and other restrictions because of this variant. Do you think this is something we could see in the United States?
I think it's something we should see in the United States. We literally based our mask mandate and the lifting of that mask mandate on Israel, for instance. Israel did a fantastic job at vaccinating their population. Literally by April 3rd, they had 60% of their population vaccinated, and they lifted their mask mandate on April the 18th. And now we're seeing, because of the Delta variant, they're saying we need to start reconsidering this so we can stay ahead of the game. And that's what I need the CDC and the World Health Organization to really make clear to the public is we don't want to be reactive. We want to be proactive and really stop this from being a pandemic within a pandemic. And the way we do that is simple public health measures, wearing a mask, avoiding those large crowds, and getting vaccines in the arms of persons.
Now, Dr. Hilton, you had talked about this, the World Health Organization now urging vaccinated people to wear those masks, and we saw that officials in Los Angeles County have issued a similar recommendation, really a reminder that these masks are still beneficial.
Yeah, they're certainly beneficial. And again, when we're thinking about traveling, I think individuals need to recognize you can't just think about your individual zip code. Some people get lax and say, oh, well, we're fully vaccinated. But if people are traveling during these summer months, they may be coming from areas, like I said, of Alabama, that's only 32% fully vaccinated, or Mississippi, where it's only 29% vaccinated. You can look at even Nevada, where they have a 93% increase in their cases over the last 14 days. If persons are traveling from those areas, it puts you too at greater risk. And it's not just a consequence of death with COVID-19. What we know is that you can get infected and you can have long hauler syndrome, right? Of where people are complaining of neurologic deficits, where they're complaining of not being able to think properly, or chronic pain now that they're having for months on end. So we can't just think about the death count and say, oh, our deaths are down. We have other things to consider, and that goes down to our youth.
Sure, those long-term effects there. And we're also seeing how vastly different vaccination progress looks around the world. Some nations making major strides, others struggling to keep up with demand. And they don't seem to have the necessary resources to even approach catching up. So how problematic are these disparities in getting this virus truly under control?
Oh, it's extremely problematic. The reason why we have the Delta variant in the first place is that the vaccines that were largely available were given to the richest countries. We have to start thinking as a global community, because the longer we allow for the continent of Africa to not be vaccinated, the longer we allow for the third world countries to not be vaccinated, we will get another Delta variant that may potentially evade our vaccine's ability to protect our bodies. And it's simply not worth it. So we have to let capitalism, or the spread of wealth, we have to let public health measures actually dictate how we roll out these vaccines and give it to those countries that have the greatest outbreak now, so we don't have to deal with it 2 months from now.
Yeah, you see how interconnected we really all are. And the chief scientist of the World Health Organization says now is not the time to encourage, quote, social mixing or mass events without precautions, regardless of where people live. So you spoke on this, but do you agree? How can we all enjoy a more lenient summer while also staying safe?
Right. What we have to realize is that even though we are tired of COVID-19, COVID-19 is not tired of us. And it has this ability to try to mutate to keep itself alive. When I think about the Olympics being held within a couple of days, a couple of weeks, that terrifies me. How many persons are going into that area where we know that vaccine uptake or distribution within Japan even has been compromised. And so what does that mean to the spreading of variants, again, around our global community? We have to realize that until we get ahead of the game, we will always be threatened with a new surge of the same type of restrictions that we saw in 2020.
Dr. Ebony Jade Hilton, thank you very much for being with us.
Thank you.